Good morning, Chair Harrington and Board. Marni, Kuyl, Director of Health and Human Services. So I'm really pleased to bring Eva Haas with me today. I think what she's bringing today is a little bit of a quick but interesting dive into some of the data that you've heard me refer to. But when I've talked about it, I've talked in generalization. So I've talked about, in general that we're seeing increased cases in 20-year-olds or the deaths that we're seeing. And Eva has some really interesting data analysis that's been done by the epidemiology team. So she's a fabulous epidemiologist that actually knows how to talk to those of us that aren't data geeks, and I say that with all kinds of love and respect because sometimes I get to be a shoestring data geek, and she helps me to understand it. So I'm going to turn it over to Eva, and then at the end I'll come back and give you really quick updates on some of the strategies that you've been interested in getting updates on.
Thank you, Marni, and good morning. Glad to be here. I think you're a little more than a shoestring geek, but we'll talk about that later. So please advance to the next slide. I am typically an epidemiologist in Marni Kyl's office and doing all kinds of things, measurement and assessment, but for the last 6 months or so, I've been functioning as an epidemiology supervisor on the COVID-19 response. So today I'm going to give a little bit of an update of the metrics to typically what Marni shares with you all, and then a little more deeper dive into our local data. So the first thing I'm going to share is what we're looking like for Oregon. You're absolutely right, Chair Harrington, that we're going up and down, but a little more up than we'd probably like to see. We're almost at 33,000 cases throughout Oregon. We're at about 780 or so cases per 100,000 people, 547 deaths, and we are looking on the upward trend for hospitalizations at a statewide level. Okay. And so this is our Washington County data. You can see there on the column that's 9/28. These are as of end of day yesterday. We have a little over 4,300 confirmed cases, 163 presumptive cases. Again, those are folks who had close contact with a confirmed case and had symptoms to meet that presumptive case definition. 342 hospitalizations and 60 total deaths. We have now 10 open long-term care facility outbreaks, 3 in congregate care settings, 24 in workplaces, and 3 in schools, daycares, and camps. And those are current snapshots and current workload, not a cumulative look. This is something I'm sure you're all very familiar with, looking at our public health indicators, so our phase 2 readiness. At the very top there is Washington County. Similar story as last week. We're meeting about 3 of those 6 metrics. You will see that large increase in our case count. That's pretty consistent across the region with some dips in our partners in Multnomah County. We are not seeing our percent of cases who are traced to a known source be under 30% this 2-week period. But we are seeing a downtrend in hospitalizations, so there is some good news. And the last piece of our regional metrics that I wanted to share was our school reopening metrics. You may have heard that Oregon Department of Education paused the test positivity metric for the month of September because of all of the closures of testing events through the wildfire smoke and evacuations. So those are no longer considered just for the month of September, but it doesn't make a big difference for us since our case count are over that threshold for the youngest learners, that K through 3, of meeting the 30 per 100,000 metric. So we were close at the beginning of September and are now above that again.